Hey everyone! If you've ever woken up with that nagging ache on the outside of your hip, especially after sleeping on your side, you know exactly how annoying and persistent it can be. Sometimes it feels like it's deep in the joint, other times like it's sitting right on the bone. Either way, it can make walking, exercising, or even lying down uncomfortable. It's such a common issue, and I completely understand how frustrating it is to keep searching for answers that never quite seem to fix the problem for good. Before we dive in, make sure to subscribe to the channel if you love learning about simple, natural ways to keep your body strong, pain-free, and full of energy. Trust me, you don't want to miss the upcoming videos. We've got lots of practical, science-backed tips coming your way. Now, let's get into it. Many times, this kind of outer hip pain gets labeled as hip bursitis. You might have even been told that's what you have, especially if you've had an X-ray or scan that shows inflammation near your hip. But here's something really important to know. That diagnosis is often wrong. Understanding outer hip pain. While bursitis can definitely cause hip pain, research shows it's the true culprit in only about 8% of outer hip pain cases. That means the vast majority of people are actually dealing with something else entirely. And because of that misunderstanding, many end up getting treatments that don't address the real cause, like unnecessary injections, endless stretching, or medications that only mask the pain. In reality, most of this discomfort comes from inflammation of the muscle tendons that lie over your hip. These tendons connect your muscles to your bones, and when they become irritated or strained, the condition is known as tendinitis or tendinopathy. The pain can feel almost identical to bursitis. It's sharp, sore, and often worse when you press on the side of your hip or lie on it at night. The good news? Whether you have bursitis or, more likely, tendinitis, there's one simple exercise that can effectively help both. It targets the real underlying weakness and irritation, allowing the tissue to heal and strengthen naturally over time. And don't worry, we're going to walk through that exercise together step by step. Practices to avoid exacerbating factors. Before we get to the good part, let's talk about what you might be doing right now that's unknowingly making your hip pain worse. These are everyday habits that seem harmless but can keep your hip irritated and slow down healing. First, if you've been stretching your glutes, especially the outer ones, stop for now. I know stretching feels like the right thing to do when something hurts, but in this case, it's like pulling on an already sore rubber band. Those tendons are inflamed and sensitive, and stretching them further can cause micro tears that keep the pain cycle going. Next, check how you sit. Do you tend to cross your legs, especially the one on the painful side? If so, uncross them. Crossing your legs may feel comfortable at first, but it compresses the outer hip tendons and puts extra pressure right where they're irritated. Over time, this simple posture can prevent your hip from fully healing. And what about standing? Many people, especially when they're tired, shift their weight to one leg and let the hip jut out to the side. I know it feels natural, almost like a resting stance, but that position overloads the outer hip muscles and tendons on that side. Try catching yourself the next time you do it and stand more evenly on both feet. Small corrections like this go a long way. And finally, a big one. Avoid clam exercises for now. These are often recommended for hip strength, but if you're dealing with outer hip pain, they can actually be counterproductive. The movement causes the inflamed tendons to rub repeatedly over the hip bone, which increases friction and irritation. Instead of helping you heal, they can make things worse. Remember, the goal right now is to reduce inflammation first, then rebuild strength safely. The effective standing exercise. Now, here's where things start to get exciting, because this one standing exercise can truly change everything for your outer hip. It strengthens your outer gluteal muscles and stabilizes the tendons around your hip, giving you both pain relief and protection from future flare-ups. The goal here isn't to stretch, it's to strengthen. When these outer hip muscles are weak, your body starts compensating in ways that overload the tendons. But once you build them back up, your hip joint becomes more stable, your posture improves, and that burning or aching pain finally starts to fade. Here's exactly how to do it. Stand on the leg that hurts. Bend your other knee so that foot is off the ground, and rest your hands lightly on a wall or something sturdy to keep your balance. From here, we'll go through 3 slow, deliberate movements. Step 1. Bring your non-painful knee out to the side as far as it comfortably goes. No forcing or jerking, just move naturally. This helps position your pelvis correctly. Step 2. Engage the outer gluteal muscles on your standing leg and slowly tilt your pelvis upward. Imagine lifting your hip bone toward your ribs on the side of your bent knee. You'll feel that muscle on the outside of your standing hip come alive. That's exactly what we want. Step 3. Slowly lower your pelvis back down to the starting position, keeping everything controlled. The slower, the better. That lowering phase works the muscles eccentrically, which is key for tendon healing. Here's a little trick. Keep these movements separate. Don't blend the knee lift and the pelvic tilt together. By isolating them, you'll ensure your glutes, not your back or thighs, are doing the work. If you're struggling to feel the right muscles, try leaning your upper body slightly away from the wall as you tilt your pelvis. It's a small adjustment that helps you hit the perfect angle and really activate those glutes. You'll know you're doing it right when you feel that gentle burn or fatigue building in the side of your hip on the standing leg. That's your signal to stop. You don't want pain or exhaustion, just controlled, steady effort. And if it feels too hard at first, no worries. Do smaller, quicker movements with a reduced range. As you get stronger, increase the height and slow the tempo. Progress at your own pace. Consistency beats intensity every time. Exercise frequency and timeline for improvement. Okay, so how often should you do this? Ideally, 3 times a week. That's enough to build strength without overworking those healing tendons. Aim for something like Monday, Wednesday, and Friday, giving yourself at least 1 rest day in between to let the tissue recover. If your issue is mostly muscle weakness, you might start feeling relief in just a few days or within 2 weeks. But if it's true tendinitis or tendinopathy, it takes a little more patience, usually 3 to 6 weeks to notice major improvement and a few months for full healing. The important thing is to stay consistent and trust the process. Your hip will thank you. Once your pain improves, don't just stop and forget about it. Keep the exercise in your weekly routine, even just once or twice a week, to maintain strength and prevent flare-ups. Think of it as brushing your teeth, but for your hips. And before starting each session, here's a great tip. Use a foam roller or tennis ball to release any tight spots in your outer glutes. Roll gently over the area for a minute or 2. It can feel a little tender at first, but it helps improve blood flow and muscle function. When your glutes are loose and warm, your exercises will be more effective and much more comfortable. Also, try combining this exercise routine with simple daily habits like walking regularly, sitting upright, and keeping both feet flat when you stand. These small posture tweaks will help support your recovery and make your hip feel more balanced overall. All right, that's it for today's session. Remember, outer hip pain doesn't have to control your life. Once you understand the real cause and start moving the right way, healing becomes much easier. This is your reminder that your body is resilient, and with a bit of consistency, you can absolutely get back to feeling comfortable and confident again. If you found this video helpful, don't forget to subscribe for more simple, science-backed tips to stay healthy, mobile, and pain-free, especially if you're looking for natural ways to heal and strengthen your body. And before you go, make sure to check the description below for product links, tools, and helpful recommendations that can support your hip recovery journey and overall health. Thanks so much for watching, and take care of those hips. You've got this.